It is now the most commonly performed cosmetic operation in America. More than 4.5 million people are expected to erase those age lines and wrinkles with Botox this year. Is it right for you? Dr. Nasrin Mani with La Jolla Cosmetic Laser Clinic is joining us this morning. And Dr. Mani, there's no doubting Botox erases the lines and the wrinkles, but I think what a lot of people don't know is you have to be really careful as to who's injecting it.
Yes, an experienced injector can do a very, very good job. Usually your injector are experienced with Botox by having the training, a surgeon, medical doctor, a nurse practitioner, a physician assistant, and nurses all can be very good injectors.
Now, what a lot of people, or one of the knocks I should say on Botox is that after a lot of people get it is their faces they have that expressionless look, but you're saying it's because they're paralyzing the wrong muscles.
They're getting too much. And for instance, I'm 54 years old and my entire face has been Botoxed, but I still can have expression. I can frown, I can smile, I can have an angry look, but I just look softer than another 54 years old who has not had Botox. It gives you a more youthful appearance. You must not be expressionless. You should have some expression, just a softer expression.
Do you think people are oversold on Botox?
Sometimes the problem is that they may get it only in the forehead and not the rest of the face. It is important in order to stay youthful, you get Botox not only between the eyebrow and forehead, you get it around the eyes, in the lower face, especially for women. As we age, our lip turns inward, and we like to give it in the bottom of the lip to evert the lip, to get a softer chin, and to prevent the corners of the mouth to come down. We like to give it in the neck, to avoid necklace line between the chest also.
Now tell us what we're looking at right here. This is obviously is a woman, I'm guessing in her 30s?
Yes, before on the top and after in the bottom. FDA has approved Botox cosmetic just for the frown line, but we do use it and it is absolutely safe to use it for the entire face.
Now, I didn't know this, but besides getting rid of the wrinkles, Botox is also used for several medical disorders as well, right?
Yes. I began using Botox in 1989 when it was approved initially for strabismus, which is crossed eye, or blepharospasm, which is uncontrolled blinking. Also, neurologists used it for migraine headache or for cervical dystonia. Then in 2002, the makers of Botox, Allergan, decided to get FDA approval for cosmetic use, and they named the same formulation Botox Cosmetics.
Now, I remember back in 2002 when Botox was first approved for cosmetic use, so there was a lot of controversy. Is it safe? You're putting botulism in your body. Is Botox safe? That's a question I'm sure a lot of people still have that haven't, kind of on the edge, haven't done it yet.
It is absolutely safe. Remember, botulinum toxin has 17 different serotypes. Botox is just type A, and you only inject minute amount with tiny needles. It is not absorbed systemically. It is localized into the muscle that you inject, so it is very, very safe.
And the big question, how much per treatment?
It's very affordable, anywhere between $200 to $800, depending on your the areas that you want to treat or how strong your muscles are.
Okay, so if people want Botox done by an experienced, a good injector, who should they call? Where should they go?
They should check to make sure that whoever they go to, whether they are surgeons, doctors, nurse practitioners, nurses, physician assistant, they have had experience in injecting Botox.
All right, Dr. Nasrin Mani with La Jolla Cosmetic Laser Clinic, thank you so much for coming in. I think a lot of people still have some questions about it, you know, and it helps clear it up.
Just log on to lajollacosmetic.com, lajollalaser.com.
Thank you very much.